Today, after almost a century of trying, today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
One of the central promises of Obama's 2008 campaign was to, in a way, complete the American social safety net, specifically for Americans who were working, were not necessarily poor, but who could not afford health insurance and therefore didn't have regular medical care. This is something that most other Western nations provide their citizens, but the U.S. hasn't historically. And he did this with a massive bill that did that and many other things. Since the 1960s, when Medicare and Medicaid passed, which basically guaranteed health care for the poor and for the elderly, it has been a priority of Democratic leaders, going back decades, to try and extend that to working people. And so when Obama came on the scene, he was really promising to complete this generation-long Democratic project. He was able to do it because the win in 2008 had been so grand. It had been such a big win, so that for a time he had a filibuster-proof majority in the Senate. He had large majorities in the House. Most Americans didn't really understand all the parts of Obamacare. It was a very complicated bill, but they had strong feelings, and those feelings tended to follow their political leanings. If they were conservative Republican, they were concerned. It looked like government expansion, overreach. If they were liberal and fans of the president's, they embraced it.
Mr. President, for years, the American people have been calling on Washington to build a bridge away from Obamacare.
The story of Republican opposition to Obamacare isn't about Obamacare. It's about the way Republicans decide to oppose President Barack Obama from the very beginning. They lost the ability in some ways to shape some of the legislation to make it more palatable, but they decided that political opposition, a permanent campaign, was more beneficial to them politically. And the biggest changes, the most visible ones and the ones that are almost certain to stay, that even President-elect Donald Trump sort of wants to keep around, are the very popular provisions around children and young adults staying on their parents' health care plan until they're 26, and then getting rid of pre-existing conditions. That is a tremendous change, and that really just a dramatic rethinking of the way insurance has been carried out in this country.